Meeting is a doctor in a hospital. One day she refuses to go to a talk about antifungal agents. A patient with a systemic fungal infection came to see her to get a treatment. She simply gave the patient oral form of itraconazole instead of IV form because she didn't know much about it. At the end, the patient couldn't recover and passed away. Mi Tang felt guilty and regret what happened, which was due to her mistakes. Lastly, she decided to go to the talk.
Hi, thanks. In my hand is an announcement about a talk about oral and IV itraconazole given by a pharmacist on this weekend. So I think it's a good talk since IV are rarely found in this hospital. So you are welcome to join it.
I don't think so. It's because IV form of itraconazole is rarely found in hospital. We can use oral form of itraconazole.
So you do not want to go it?
Sure. How about you?
Yes, because I don't know so much about IV itraconazole, so I think you can also accompany me to this talk.
I'm sorry, Adila. Actually, this weekend I'm very busy.
It's okay then. The patient outside is waiting for you.
Oh, I see. Okay, Adila. Thank you for it.
Okay, thank you. See you.
5 days after, the patient died due to worsened infections. Oral form of itraconazole is not suitable for systemic fungal infections. Mi Tang regrets what happened and so she decided to go to the talk.
Hey, good morning everyone. My name is Beijing, or you can also call me Beijing. So today I as a pharmacist am going to give you a talk on the pharmacokinetics of the oral form and also the IV form of itraconazole. I'm sure that all of you are clear that itraconazole is an antifungal agent, right? Okay, yeah, very good. Okay, so throughout this talk, I hope that we all can share information with each other. And if you have any knowledge or experience that you want to share with me or with everyone, please feel free to do so. So let's get started. Firstly, I'll share with all of you on the pharmacokinetics of the oral form of itraconazole. Okay, so actually itraconazole capsules have a low dissolution level. So to actually increase the absorption, you can actually recommend your patients to very interesting. Actually, you can recommend them to take cola beverages together with the capsules. So you have heard of that before, is it? No. Okay, but okay, never mind. So actually, why we ask them to take cola beverages, because it can actually help to lower the gastric pH and also improve the absorption of itraconazole capsules, because it works better in a relatively lower pH of your gastric. So, but it's also good to actually tell the patients to take this drug after meals to increase the absorption as well.
But I remember that food actually decreases the absorption of this drug.
Well, actually there is some confusion regarding that matter. Because food actually increases the absorption for itraconazole capsules, but decreases the absorption of itraconazole oral solution. So actually what you are referring to is actually the oral solution of the itraconazole.
Oh, I see. Thank you for the info.
No problem.
Excuse me, but if I'm not mistaken, they should also avoid grapefruit juice because it may impair the absorption of the itraconazole capsule.
Well, but what you say is actually true, but yes, because there's actually a study done on this matter, whereby they tried to administer itraconazole together with double-strength grapefruit juice, and they realized that the therapeutic effect of the drug after taking this grapefruit juice is relatively lower, or rather lower than without taking the grapefruit juice. So yes, what you said is correct. Well, which brings us back to our ADME, the distribution part. So for distribution route, you can see here is highly bound to the erythrocytes or the RBC, which I'm sure all of you know about that, and also the plasma proteins. Now, the major setback for this oral form is that its distribution is very low in our body fluids.
So you mean like the cerebrospinal fluid and the saliva?
No, that's very correct. Now this drug, as you can see here, is actually metabolized in the liver, and it is also eliminated by the kidney. But please be careful, because if you administer large doses of oral itraconazole, it can actually lead to nausea and also diarrhea in patients. So, okay, good. Since all of you are clear, so let's move on to our IV form. So, when you look at IV form, intravenous form of itraconazole, well, I'm sure that you all are clear that for absorption, it actually means that the drug is being administered through the vein. So, but in terms of distribution, it's actually better than the oral form of itraconazole, because it achieves effective plasma bound, or rather the therapeutic effect, faster than the oral form.
So it means that the therapeutic effect of the IV form is faster than the oral form?
Yes, that's exactly what I actually want to tell all of you. Okay, so let's go back to our ADME again. So for for metabolism, it still remains the same. It's still metabolized in the liver, same as the oral form. And the elimination is eliminated by glomerular filtration, which I'm sure all of you are aware of that, which is occurring in the kidney. And yes, it has lower side effects compared to the oral form. So are you all clear? Do you have any more questions? Crystal clear? Okay.
Yeah.
Okay, so that brings me to the end of my talk for today. So thank you very much for your attention. Hope that all of you have gained some input from my talk for today. Okay, thank you.
Thank you.
Malaria is a life-threatening infectious disease commonly found in tropical areas such as Africa, Central and South America, Southeast Asia, and the Pacific Islands. It is caused by a parasite called Plasmodium, which is passed through bites from mosquitoes carrying the parasite. In 2010, malaria caused an estimated 655,000 deaths, mostly among African
Good morning,
children.
doctors. I am Hidu Gayatri, the pharmacist from HUSN. I am here today to give a talk on side effects of anti-malarial agents in Malaysia, namely chloroquine, mefloquine, quinine, proguanil, and primaquine. Okay, before I start my talk, I would like to inform doctors, you may ask and clear your doubts while I am giving the talk. Okay, first of all, let's discuss on chloroquine. As we all know, it is effective in treating Plasmodium falciparum and administered orally. 4 days of therapy can cure the disease. However, use of chloroquine is characterized by frequently experienced minor side effects like gastrointestinal problems, blurred vision, postural hypotension, and headaches. These minor effects can be lessened by taking tablets with food or taking half of the dose on 2 occasions each week. As for the retinal changes, including eye damage and blindness, may occur after prolonged use, but on the usual 300 mg per week dose each would be only taking 6 to 7 years. And chloroquine should be used continuously in patients with hepatic dysfunction and severe GI problems, as well as patients with neurologic and blood disorder.
Miss Hega, may I ask, for chloroquine, so will there be any problems during pregnancy?
Since no abortifacient or teratogenic effects has been reported over the years, it is safe to use this drug chloroquine during pregnancy. The next drug is mefloquine. This drug is administered orally as well and has a long half-life. The most serious adverse effect of mefloquine treatment is neuropsychotic toxicity, and its symptoms can range from mild to life-threatening. As a result, people would be having thought of suicide and seizures. Thus, people with known psychiatric illnesses and epilepsy should be avoided using this medication. And remember that mefloquine can be only taken up to 6 months due to these side effects. After this, other drugs like Nivaquine again need to be taken.
Miss, about the drug mefloquine, is it advisable for even pregnant women to take it?
As for this drug, it is not recommended to use during the first 3 semesters although it is safe to be used during the second and third trimesters. Women are advised to use contraceptives during and for 3 months after administration of metformin. Okay, the next one is quinine. The most prominent side effects of quinine is synchronism, and it can be told as the reversible effect, as it can disappear once quinine is withdrawn from the body. It can cause paralysis if it's accidentally injected, and quinine also can cause hypoglycemia through its action of stimulating insulin secretion. Repeated or overdosage can result in renal failure and death through depression of the respiratory system. As for the drug proguanil, its prominent effect is on the primary tissue stage of Plasmodium falciparum, P. vivax, and P. ovule. It has a weak blood schizonticidial activity, thus not recommended for the therapy of acute infection. Proguanil is one of the most safest antimalarial drugs, and its common side effects are dizziness, nausea, and GI symptoms. It is useful in prophylaxis when combined with atovaquone or chloroquine in areas where there is no chloroquine resistance. The last drug is primaquine. It is administered orally as well, and it is effective against exoerythrocytic form and gametocytic form of malaria parasite. It can cause abdominal discomfort and metaimmunoglobulinemia, which is an inability of red blood cells to transport oxygen due to disorders in hemoglobin. It can also induce hemolytic anemia, which is a condition of excessive breakdown of red blood cells that reduces the red blood cell count. Remember that it is contraindicated during pregnancy. That's all from me. Thank you for listening. If you have any doubts to clear, please contact me to my phone number or through my email.